Guys, in this video we will be talking about the heme synthesis pathway and the very easy mnemonic to remember the porphyria. Watch this video once and porphyria is sorted forever, guys. You won't forget this after watching this. Okay, so first we'll start on, guys, with the heme synthesis. So see, we have three reaction, guys, that takes place in the both cytoplasm and the mitochondria. Okay, remember, like, if you hug someone, yeah, you need 2% to hug. Okay, so this hug pathway takes place in both in mitochondria and the cytosol. So hug, H is for heme synthesis pathway, U is for urea cycle pathway, and G is for gluconeogenesis pathway, guys. Okay, so see, now coming on to the heme cycle pathway, guys, which is the topic of choice for today because we need to study porphyria. Okay, see, first of all, this takes place both in the cytoplasm and the mitochondria, guys. So the first one that starts with, when you start something, you remember the almighty God, that is mighty. So when you remember, you start with mighty, that is will start from mitochondria. So this glycine combines with succinyl coenzyme. Okay, guys, where do you get this succinyl coenzyme? You might have watched my video of Krebs cycle. You know the succinyl Allen Career Coaching Institute of Kota, sure success for medical student. So there, that sure was succinyl coenzyme, guys. Okay, so this is the succinyl coenzyme. So when glycine combines with succinyl coenzyme, guys, okay, so aminolevulinic acid is formed, guys. Okay, so and the enzyme is, guys, aminolevulinic acid synthetase, guys. Okay, see, when aminolevulinic acid, guys, it gets dehydrated, guys. Okay, then it forms porphobilinogen, guys. Okay, this porphobilinogen, guys. Okay, so this porphobilinogen, there is an enzyme known as porphobilinogen deaminase, guys, which is also known as uroporphyrinogen 1 synthetase, guys. Okay, so this forms hydroxymethylamine, guys. Okay, this hydroxymethylamine, guys, there is an enzyme known as uroporphyrinogen 3 synthase, guys. Okay, and this forms uroporphyrinogen 3 co-synthase, guys, from congenital erythropoietic porphyria, guys. Okay, see this, so this is uroporphyrinogen 3, guys. Okay, this uroporphyrinogen 3 is transformed to coproporphyrinogen 3. Okay, remember UCP, guys. Okay, that is uroporphyrinogen 3, coproporphyrinogen 3, then you have protoporphyrinogen 9, guys. Okay, this protoporphyrinogen 9 convert into protophyrin 9, guys. Okay, and this protoporphyrin 9 gets incorporated with iron to convert into heme, guys. Now we'll remember how to remember the mnemonics for the cycle, guys. Okay, so it's very easy, guys, just try to pay attention and I think this gets sorted for you. See how I have remembered. We are studying porphyria, maybe in order to pass your university exam or to crack a NEET PG set. Okay, so see, first of all, remember this is the ALAS. Okay, ALAS. ALAS means you are lazy, guys. Okay, so this is lazy. ALAS, that what is this? This is aminolevulinic acid synthetase, guys, and it requires vitamin B6. Vitamin B6 is which vitamin, guys? Pyridoxine. That means it requires PLP, guys. Okay, see, so this is, first we'll talk about all the enzymes, then we'll talk about the which enzyme deficiency causes which porphyria. So first of all, it's ALAS, guys. Okay, that is aminolevulinic acid synthetase, guys. Okay, so when now what you are doing, you have ALAS chhod dala, guys. Okay, when you leave the ALAS, guys, you need to work hard, you need to sweat, that is dehydratase. You are dehydrating. Aminolevulinic acid dehydratase, guys. Okay, when you have left your ALAS, guys, that is dehydratase, guys. Okay, after you have left you have dehydrated yourself, work hard, guys. Okay, so for work hard, what will happen, guys? You are working hard for what is your aim, guys? Whenever you are work hard, you have a aim in your life, so your aim is PG degree, that is porphobilinogen deaminase, guys. Okay, PG degree, that is PGD, porphobilinogen deaminase, guys. Okay, so the aim is PG degree. To achieve your aim, what do? You work hard, guys. So that is you study. That is uroporphyrinogen 3 synthetase, guys. Okay, then you study, guys. Okay, then remember you are working for this 3 years. The course for MD or MS is of 3 years, guys. Okay, so you study for those 3 years, guys, because you need to make your next 3 years good. Yeah, so you study. Then, guys, what happened? When you study, you need to do something dedicatedly. That is you dedicate, guys. That is uroporphyrinogen decarboxylase. Okay, you have decided you have studied hard and you have dedicated completely, guys. That is coproporphyrinogen oxidase. But there are some people who do not realize studying. That is they postpone, guys. That is protoporphyrinogen oxidase. And if you postpone, guys, no chance of passing. That is you fail. That is spherochelatase, guys. Okay, so just remember the mnemonic with me. There is a ALS. You leave your ALS. That is amino levulinic acid synthetase. Okay, when you leave a ALS, you will dehydrate with sweat. Okay, that is amino levulinic acid dehydratase, guys. Okay, okay, when you have left your ALS, you have a amino life. That is PG degree. That is porphobilinogen deaminase. Okay, to achieve that PG degree, you study. That is uroporphyrinolactone 3 co-synthase. Okay, then you study, guys, then you dedicate completely, that is uroporphyrinolactone and decarboxylase, guys. Okay, then you dedicate, after you dedicate, you need to dedicate completely, heart and soul must be put, guys. Okay, completely is coproporphyrinolactone oxidase. Then some people who postponed is protoporphyrinolactone oxidase, and fail is, guys, ferrochelatase. Hope this helps, makes you remember the entire enzyme that are there in the cycle. Now see, how will you remember which enzyme causes what, guys? Okay, see, this is very simple, guys. Okay, then you have ALS. Okay, so this ALS people, okay, so this ALS is of two type. I mean, there is X-linked sideroblastic anemia, guys, and there is X-linked protoporphyria, guys. Okay, so this is not very important, guys. Okay, this is not very important. Now coming on, guys, to the amino levulinic acid dehydratase, guys. Okay, so this amino levulinic acid, guys, dehydratase, guys. Okay, if you talk about this enzyme, guys. Okay, so this enzyme is inhibited by lead, guys. Remember this two important things. Lead inhibits two enzymes, guys. Okay, that is ALA dehydratase and ferrochelatase. Lead inhibits both of this enzyme. Okay, so this is important, guys. Okay, now see, then you have the next one, guys, that is porphobilinogen deaminase, also known as uroporphyrinolactone 1 synthetase. Okay, guys, see, 1 synthetase, that is one first letter, that is A, that is known as acute intermittent porphyria, AIP, guys. Okay, see, then you have the hydroxymethylene. Okay, so this hydroxymethylene will form uroporphyrinolactone 3. Okay, see, third letter, that is congenital erythropoietic porphyria, guys. Okay, CP, C is third letter, 3 is third letter, guys. Okay, say, now uroporphyrinolactone 3 UCP, that is coproporphyrinolactone 3. What will be there? You have studied hard. Now you need to dedicate. That is uroporphyrinolactone decarboxylase. That is Porphyria cutanea tarda. Remember, there is only one porphyria, guys, that has a D in name, guys. That is tarda D. That is decarboxylase, guys. Okay, remember this, guys. Or how can you remember Porphyria cutanea tarda? That is PCT. The short form of Porphyria cutanea tarda is PCT. That is Porphyria communis, guys. Okay, so this is the most common type of Porphyria, guys. Okay, see, after coming on to this coproporphyrinolactone 3 to protoporphyrin 9. Okay, that is coproporphyrinolactone oxidase, guys. Okay, so what is the name of this porphyria, guys? This is known as, guys, hereditary porphyria. Okay, hereditary porphyria. Okay, so how I have remembered, guys? I have remembered it as choco. Okay, see, that is guys, hereditary porphyria. Okay, guys, that is coproporphyrinolactone oxidase, guys. Okay, now see, this protoporphyrin 9 will form protoporphyrinolactone 9 will form protoporphyrin. That is in the presence of protoporphyrinolactone oxidase. If there is a deficiency, this is known as varicate porphyria. How we have remembered? Vada pav. Okay, guys, see, if you talk about varigate porphyria, that is protoporphyrinolactone oxidase, guys. Okay, now this protoporphyrin 9 will form heme, guys, in the presence of iron. So that is ferrochelatase. See, FER, that is ferrochelatase deficiency causes erythropoietic porphyria, guys. Okay, I think hope this helps you remember, guys. Further in a table, I have a table that will help you summarize which are autosomal recessive, what are the enzyme. Will revise one again, guys, in the table. Okay, see, this is a summary table, guys. Okay, see, glycine plus succinyl coenzyme. Think with me, guys. Glycine plus succinyl coenzyme. These two were combining to form what? Amino levulinic acid, guys. Okay, and what was the enzyme, guys? That was amino levulinic acid synthase, ALS, guys. Okay, this amino levulinic acid, guys, remember what was next enzyme after synthesis? Sweating, that is dehydratase, ALA dehydratase. Okay, what will it form, guys? That will form porphobilinogen. Okay, then think of next thing, guys. Okay, that is what is the enzyme is porphobilinogen deaminase, that is PG degree. Okay, so what this form? Hydroxymethylene. This enzyme is also known as, guys, hydroxymethylene synthase, guys. Okay, why? Because this is forming hydroxymethylene, guys, or uroporphyrinolactone 1 synthetase. Okay, guys, see, now this hydromethoxybilene, remember, guys, what is the next step? That is you study, that is uroporphyrinolactone 3 co-synthase, guys. Okay, so what will form this form, guys? This will form uroporphyrinose. Remember, U, then is C, then it is P. Okay, guys. Then what will it form, guys? Now this is, guys, uroporphyrinose 3. So uroporphyrinose 3 will form, guys, what? CP, that is coproporphyrinose 3. That is in the presence of enzyme you dedicate, guys. Okay, after you dedicate completely, that is coproporphyrinose oxidase, guys. So what will be formed? Protoporphyrinose 9, guys. Now this protoporphyrinose 9, guys, will form protoporphyrin 9. When you dedicate completely, some postpone, guys. Postponed is protoporphyrinose oxidase, guys. Okay, and then is the ferrochelatase, guys. Okay, that is you fail, that is the ferrochelatase, guys. This one was the postpone wala, guys. Okay, this was, guys, complete wala, you study completely, guys. That is you dedicate here, guys. Okay, here it is, guys, you study. Okay, sorry guys. Okay, this is you study, guys. Okay, this is, guys, PG degree. Okay, this is, guys, you have left your ALS. Okay, आलस छोड़ डाला, remember, like डाला, that is ALA dehydratase, guys. Okay, and this is ALS, guys. Okay, see, now coming on to the various porphyria, guys. Okay, so first porphyria is known as the X-linked porphyria. Now you can remember this is the X-linked inheritance, guys, no confusion. Now coming on to the other porphyria, guys. See, you have ALA dehydratase, the second enzyme, guys. So this is ALA dehydratase deficiency, guys. Okay, then, guys, that is uroporphyrinose 1 synthesis, that is acute intermittent porphyria, AIP, guys. Okay, now, guys, 3 co-synthesis, that is CEP, congenital erythropoietic porphyria. D, only porphyria that has D in the name, guys. Then completely, that is coproporphyrinose oxidase, guys. How did I remember that? I have remembered as choco. Okay, that is hereditary coproporphyria, guys. See, you can see it, guys. Now protoporphyrinose oxidase, guys, what will it cause? It causes this I have remembered, guys, as vada pav. Okay, so that is variegate porphyria is associated with protoporphyrinose oxidase, guys. Okay, now this protoporphyrinose 9 will form protoporphyrin 9, guys. Okay, that is ER, ferrochelatase. Okay, so this ferrochelatase, guys, will cause erythropoietic porphyria. So now this heme is formed, guys. Okay, and heme will further go what? Hemoglobin, you know, the main component of hemoglobin is heme. Myoglobin, that is present in the muscle, and it is also required for the activation of enzymes and other things like catalase, peroxidase. Okay, tryptophan, pyrrolase, guys, these are the enzymes, peroxidase. Okay, so this is all about the heme synthesis pathway, guys. Okay, see, in this table, the mnemonics that I said, I have tried to summarize, guys. See, there are few in the acute intermittent porphyria. Now think, guys, this is the first letter A. That means, guys, it is uroporphyrinose 1 synthetase deficiency, and it is also known as hydroxymethylene synthase, guys. Okay, you can see also known as porphobilinose and deaminase, guys. See, congenital erythropoietic porphyria, this C can be made into a G. This is also known as, guys, Gunther's disease, guys. Okay, so this is also known as Gunther's disease, congenital erythropoietic porphyria, and C is the third letter, that is uroporphyrinose 3 co-synthase, guys. Now porphyria cutanea tarda, remember, guys, this is the porphyria commonest, guys. Okay, it has only one porphyria which has D in its name, that is, guys, enzyme is decarboxylase. Okay, guys, you can say. Then variegate porphyria, remember it as vada pav, that variegate VA, and pav means protoporphyrinose oxidase, guys, that is connected, vada pav is connected, guys. Okay, then you have erythropoietic porphyria, guys. Okay, so this erythropoietic ER, that is ferro, FER. Okay, guys, so that is ferrochelatase, guys. Okay, now see, guys, here what I have talked about, which are the porphyrias, what are the clinical features, guys, that porphyria will manifest, guys. Okay, if we talk about the clinical features of the manifestation of porphyria, guys, there are some porphyrias, guys, which are acute, guys, and there are some are which are chronic porphyrias. Okay, see, so the porphyrias, guys, which are acute, guys. Okay, that is acute intermittent porphyria, ALA dehydratase porphyria, variegate porphyria, hereditary porphyria, guys. Okay, now see, there's some porphyrias, guys, which are chronic, guys. Okay, that is, remember it as, guys, CEP, guys. Okay, CEP you can remember, guys, or CP, whatever you want to remember, guys. Okay, see, so this all the 3 porphyrias, guys, congenital erythropoietic porphyria, and porphyria cutanea tarda, guys, all of these 3 porphyrias, guys, are the chronic porphyrias. Means this three porphyrias will shows the skin manifestation like photosensitivity, guys. Okay, so this is important from the MCQ aspect, guys. Okay, now see what are the clinical features of acute porphyria and what is the clinical features of chronic porphyria, guys. Okay, this chronic porphyrias, guys, result in a dermatological problem, that is a skin lesion or photosensitivity. Okay, cutaneous sign result from photosensitivity, that is skin fragility, guys. You can see the multiple blistering disorder. Do you see, guys? Okay, in porphyria cutanea tarda. Okay, so this if you are shown an image, guys, okay, this can be asked as a image based question, guys. Okay, you have an image, guys, where they show that there is a patient having porphyria and rash gets exacerbated by sunlight, guys, because it is a cutaneous manifestation, guys. When they ask you something, you have 3 DDs in your mind. If you have not mentioned about the inheritance, guys, what are the 3 things that you will remember, guys? That is CEP. What is CEP? Congenital erythropoietic porphyria, and porphyria cutanea tarda. So you will think, what is the answer if you have 3 things, guys? Which one is the commonest? That is porphyria cutanea tarda is the porphyria commonest, guys. Okay, so this is the porphyria cutanea tarda, guys. Okay, now see what are the manifestation of acute porphyria. This acute porphyria, guys, this causes mainly neurovisceral manifestation, guys. Okay, so internal, visceral means internal organ, and neuro means CNS and other things. See, guys, there is the abdominal pain, that is the most important. You have muscle weakness, guys. You have focal neurological deficits, guys, because neural problem is there. This is, guys, neurovisceral, guys. Okay, so you have neural problem also, guys. That is psychiatric symptoms, guys. Okay, you have discolored urine, guys. This is very important. Urine turns dark or red. I have an image included for the, guys. I'll show you the image. Okay, see, this is the summary table of all the porphyria, guys. Okay, see, glycine and succinyl coenzyme, just try to revise, that is ALA, alpha amino levulinic acid. This ALA, what is the enzyme, guys? ALA dehydratase. Okay, and this will form porphobilinosin. This porphobilinosin in the presence of enzyme, guys, what? Porphobilinosin deaminase, guys. Okay, this porphobilinosin deaminase, okay, will form hydroxymethylene. This hydroxymethylene gets converted into, guys, uroporphyrinosin 3 in the presence of which enzyme, guys? You have got a PG degree, means you are aiming for PG degree, means you study, that is uroporphyrinosin 3 co-synthase, guys. You study, guys, then you dedicate, that is uroporphyrinosin decarboxylase, guys. Okay, that will form, guys, form coproporphyrinosin 3. This coproporphyrinosin 3 will form protoporphyrinosin 9, that is coproporphyrinosin oxidase, guys. This coproporphyrinosin oxidase, guys, okay, this protoporphyrin 9 will be converted into protoporphyrin 9, guys. That will be protoporphyrinosin oxidase, and further the spherochelatase will help you convert the heme, which will form other hemoglobin, myoglobin, and activate other enzyme, guys. Okay, you can see all the enzymes that are listed here, guys. Okay, now see what we'll talk about, guys. What are the product accumulated? See, I'll take an example of this porphobilinosin deaminase, guys. Suppose this porphobilinosin deaminase, what does it do? It converts porphobilinosin into hydroxymethylene. If this steps does not occur, what will happen, guys? The previous metabolites will increase, means there is an increase in urinary aminolevulinic acid, guys, and there is an increase in porphobilinosin. So basically that was all the table about accumulation product. Okay, now we'll talk about what are the major symptoms, guys. Okay, whether it is a cutaneous problem or there is both cutaneous and neurovisceral problem, or if there is only neurovisceral problem, guys. Okay, and see, this is very important point for porphyria cutanea tarda. This was the commonest porphyria. Okay, and here the rash gets exacerbated by alcohol, guys. Okay, so this is very important, guys. Okay, now we'll talk about the cutaneous problem. Remember, guys, if we talk about only cutaneous problem, remember, when does cutaneous problem enhance, guys? When you go in sunlight, guys. When you have skin rashes, most of you, that is cutaneous problem enhanced. CPE. C is for congenital erythropoietic porphyria. P is for, guys, porphyria cutanea tarda, and this is, and E is, guys, that is erythropoietic porphyria, guys. Now talking about both problem, guys. So when do we have both? India is a varied heritage. India has a lot of culture, means it has everything, guys. Okay, then that is, guys, H is for, guys, hereditary porphyria, and variegate ka V is for variegate porphyria, guys. Okay, now coming on, guys, to the acute porphyria, that is A wala porphyria, guys. We have two A wala porphyria, acute intermittent porphyria, guys, and the AL hydatitis porphyria, guys. Okay, see, now coming on to remember the mode of inheritance of the porphyria, guys. See, It's very memorable. When you have a varied heritage, means varied AD comes, guys, then means both the porphyria are autosomal dominant. Now see, when you have a cutaneous problem, so what is the precaution doctor says you? Take care when you go out in the sun, guys. So care as AR, okay, that means it's autosomal recessive. Which are the two porphyria? C is for congenital erythropoietic porphyria, E is for erythropoietic porphyria. Means porphyria cutanea tarda, guys, is the autosomal dominant wala porphyria, guys, because this is the commonest wala porphyria. Okay, see, the common things are more dominant, guys. Okay, so this is the commonest wala porphyria, guys. Okay, now talking about acute intermittent porphyria and ALA dehydratase wala porphyria, guys. Okay, this acute intermittent porphyria, remember, guys, most of the porphyrias are autosomal dominant, guys. Okay, so acute intermittent porphyria, or you can remember AIP is there. If you do AIDP, guys, that is there is also a term in medicine. If you do acute intermittent demyelinating polyneuropathy, D comes, D fits well, guys. Okay, so this is also autosomal dominant. And one is, guys, that is ALA dehydratase, that is autosomal recessive, guys. Okay, now see, acute intermittent. So all the symptoms of acute that we talked about, guys, that is there is a deficiency of porphobilinogen DMNS, pain abdomen most common, guys. The psychological, what were the psychological? Agitation, anxiety, there could be peripheral neuropathy, there could be peeing abnormality, and guys, okay, this is precipitated by drugs, guys. This is important, this barbiturates and oral contraceptive. So guys, this is contraindicated. So remember, guys, if you talk someone when does the skin enhance? See, cutaneous problem increase. C is for, guys, congenital erythropoietic porphyria. P is for, guys, porphyria cutanea tarda. Okay, enhance. E is for erythropoietic porphyria, guys. Okay, so this was all about the porphyrias, guys. Okay, that we need to know. Okay, guys, see, this is a photo that shows erythrodontia, guys, that you can see the color of the teeth, guys. Okay, see, this congenital erythropoietic porphyria, I've already said this is also known as Gunther's disease, guys. Okay, the revise one of this along with me, guys. Congenital erythropoietic porphyria, that is third letter. Okay, guys, so third letter will form, guys, 3, that is uroporphyrinogen 3 co-synthase, guys. Okay, and there is erythrodontia also, guys. Okay, there is other features like hemolytic anemia and other things, guys, that can be found here, guys. Okay, I think hope this helps you revise entire porphyria and the heme synthesis pathway. Hope this makes it easy, guys. Just remember the summary table one. Remember the story that I said. If you have आलस छोड़ डाला, guys. Okay, that means you are aiming for PG degree, then you need to study, you need to dedicate completely, guys. If you postpone, you fail, guys. Okay, now see, think about, if I am asking you, guys, which one of the following enzyme deficiency causes variegate porphyria? Think, guys, variegate, that is vada pav. It means PAO, that is protoporphyrinogen oxidase, guys. Okay, so try to think in your mind, make a mind map, guys. Try to recall, and I think this will make it super easy, guys. Okay, if you try to recall it once. Also, guys, the important point that I missed out, guys, see, this out of the steps of the pathway, guys, there are 8 enzyme total, if you see, guys. Okay, so this first enzyme and this 7 and 8 enzyme, guys. Okay, first 6, 7th and 8 enzyme, guys, this enzyme is there in the mitochondria, guys. Okay, when you are starting, guys, you remember the god, and when you are at the end, about to end, guys, okay, you need help from someone, you need motivation from someone, that time you remember your almighty, that whatever you have worked hard, may you get the success. Okay, so that is first 6, 7, 8 steps, guys, takes place in the mitochondria, guys. Okay, and the next second, third, fourth, fifth step, guys, takes place in the cytoplasm, guys. Okay, I think hope this helps you remember entire porphyria, guys. Do comment, like, share if you find it useful, guys. Do comment which topic you need. Thank you, guys. Happy learning.